Hi friends, good evening and welcome to my channel. Friends, daily we are seeing some important exam based points. Maybe question can come from this area. And today's important points we can see the first point is the pH of pancreatic juice is 8 and it is alkaline in nature. And the enzyme present in the pancreatic juice is amylase and lipase. And the next point, the average daily production of bile is per day it is 500 to 1000 ml. And the next point, the first part of colon is called cecum. And the next point, the tiny functional unit with which the lobes of the liver are made up of, that is, the lobes of the liver are made up of lobules. This is the tiny functional units of the liver. And the next point, the pear-shaped sac attached to the posterior surface of the liver is called gallbladder. That is, gallbladder is a pear-shaped sac. It is attached to posterior surface of liver. And the next point, acute fungal infection of epithelium of the mouth caused by Candida albicans is called oral candidiasis. That is, acute fungal infection of the mouth is called oral candidiasis. And the next point, severe ulceration of the gums. That is, ulceration of the gums. It affects the lips, mouth and throat by Borrelia vincenti. That is, Borrelia infection is called acute gingivitis or Vincent infection and also called Vincent gingivitis. It is a type of Borrelia infection. And the next point, the commonest viral infection caused by herpes simplex characterized by very painful ulceration of the mouth is called acute hepatic gingivostomatitis. It is a very painful ulceration of the mouth caused by herpes simplex virus. And the next point, the commonest type of malignant tumor in the mouth is squamous cell carcinoma. And the next point, acute inflammatory condition of the salivary glands caused by the infection of paramyxovirus is called mumps or parotiditis. That is, infection of paramyxovirus in the salivary glands is mumps. And the next point, difficulty in swallowing is called dysphagia. And next point, the bacteria which can survive in the gastric mucosa and cause peptic ulcer is Helicobacter pylori. That is the infection caused by, that is infection of the peptic ulcer is H. pylori bacteria. And the next point, regional ileitis is also known as Crohn's disease. And the next point, jaundice due to increased destruction of RBC is called hemolytic jaundice. Hemolytic jaundice means increased destruction of RBC. And the next point, jaundice caused by the obstruction to the flow of bile is called obstructive jaundice. Obstructive jaundice means obstruction to the flow of bile. And the jaundice caused by as a result of damage to the liver is called hepatocellular jaundice. And the next point, organ which is known as windpipe is trachea. And the next point, voice box in the human body is larynx. And the next point, formation of stone in the gallbladder is known as cholelithiasis. Cholelithiasis means stone in the gallbladder. These all are important points.